In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a registered nurse explaining to a student the uses of a peak flow meter. Now read the question.
Dr. Matthews wants us to monitor Lucas Young in bed 6 using a peak flow meter. Are you familiar with this device?
I've seen them before, but I thought they're only used in special circumstances.
In short-term monitoring, they can be very useful for a number of reasons. For example, if a patient has suspected occupational asthma, the peak flow meter can help diagnose or exclude the possibility of asthma. It's also handy in monitoring a patient's response to new medication, or in this case, a change in dose. In most cases that I've witnessed, they're used to calculate the trigger point for a written asthma action plan.
I see.
You hear an emergency department physician discussing a patient with a colleague. Now read the question.
In bed 5, we have Jason Burgess, a 6-year-old boy with a suspected accidental minimal ingestion of eucalyptus oil. His initial symptoms included mild CNS depression, drowsiness, and ataxia. On admission, his breath smelled very faintly of eucalyptus. At the time of the incident, his mother was in the bathroom where there was an exposed bottle of eucalyptus oil on the vanity. She was distracted only momentarily, but when she looked back, she noticed oil droplets on the front of Jason's shirt as well as on his lower lip and chin. She cleaned his mouth and changed his clothes and thought he was fine, but around an hour later, she noticed his change in demeanor. We need to continue to monitor his vitals and watch for any changes in his current condition. He's appeared more alert over the last hour, so it's looking positive, but we can't be too careful in a case like this.
You hear a nurse educator briefing a student nurse about the importance of compression stockings. Now read the question.
Compression stockings are specifically designed to apply pressure to the lower legs, helping to maintain blood flow and reduce discomfort and swelling. They fit very snugly to help the body's circulation, but that means they can be rather uncomfortable, so not all patients like wearing them.
So does that mean all patients have to wear them?
Not all, but we encourage their use for post-op patients and especially for particular conditions, such as Mrs. Jones in bed 6.
Okay, so why is it so important for her? I was told they are very expensive.
Mrs. Jones suffers from lymphedema, which is a chronic condition that causes swelling in the body's tissues, but particularly in the arms and legs. Compression stockings can help blood in the veins return to the heart, and a patient's health should never be compromised or impeded by cost-cutting measures.
You hear an audiometry nurse talking to her colleague about a recent patient. Now read the question.
I just had another patient who works as a bartender and now has noise-induced hearing loss. That's the 3rd one this month.
It's very common, but then it's their choice to work in that environment.
Of course, but I doubt they go into it with the intention of losing their hearing. Surely the employer should be held accountable.
Perhaps, but it's still a personal choice.
Yeah, I guess.
Plus, they earn more than us with all the tips they get. When was the last time we were given a tip for what we do?
You don't expect to get tips, surely.
Of course not. I'm just saying they get paid very well for what they do. They don't have to spend money studying, and they still do well for themselves.
Yeah, true, but being paid well doesn't justify losing your hearing.
I don't know. It seems like a fair trade to me.
You hear a nurse giving instructions on subcutaneous injections to a patient. Now read the question.
Subcutaneous injections are given with a very small needle that causes little or no discomfort. It's important to find a comfortable, well-lit working place to do the injection. Remember that preparations for each injection are as important as the injection itself. Plan to do your injection at the same time each day. Consistency is key. Make sure it's the medication your doctor prescribed and always check the expiration date on the vial. If it is past its expiration date, make sure not to use the medication. The same goes if you see any particles or discoloration. Just take it back and check with your doctor or pharmacist. You should get into the habit of cleaning your work area with soap and water. Dry off the work surface with a clean towel and then begin to assemble your medication, disposable syringe and needle, your alcohol swabs and puncture-proof disposable container.
You hear two nurses at a training day discussing a lecture. Now read the question.
I can't believe we just wasted 20 minutes listening to a lecture on how to deal with patients with a fear of needles.
Didn't you find it helpful?
Oh, come on. That entire lecture was aimed towards a student with zero experience.
I know what you mean, but I found the tips on how to get them through it quite interesting, actually. Especially from before you begin, like watching their body language or asking them to lie down. I mean, some patients faint before you even touch the skin.
Didn't you already know that? You've been nursing for years. It's so obvious.
Of course it's obvious, but it's good to hear it, especially knowing I'm not alone in finding my patients with needle phobia difficult to handle.
I think I should have gone to the respiratory review on lung sounds.